Hello and welcome to our third and final webinar on confirming health status. In this session we will cover checking physical health status, identifying variations from normal physical health status, human life processes and homeostasis. We'll start this session by talking about the importance of making checks on clients' health status prior to delivery and implementation of lifestyle activities. It's essential that you make these checks on a client's health status using your knowledge of the body systems that was discussed within webinar 1. To complete these checks on a client's physical health status, it can include things such as assessments and examinations. These will most likely be completed by your supervisor. You should ensure you know the types of health checks that will be used and the purpose of each of these health checks. It's also vital that you follow your organisation's policies and procedures when these health checks are getting completed. One of the most common checks that are completed on clients and residents within aged care facilities and the community is to check their vital signs. Have you heard of this term before, vital signs? If so, do you know what vital signs are? For those of you already working in the aged care industry, you may be familiar with this term. Vital signs are measurements taken of blood pressure, pulse, also known as heart rate, temperature, respiratory rate, and blood oxygen saturation. Let's now look at the healthy ranges for vital signs. For blood pressure, also known as BP, the healthy range is 120 over 80 millimetres of mercury. For pulse, the healthy range is between 60 and 100 beats per minute, dependent on the person's physical health status and their age. Temperature, the healthy range is between 36.5 and 37.5 degrees Celsius, with the average temperature being 36.7 degrees. Respiratory rate, with the healthy range between 10 to 16 breaths per minute. And blood oxygen saturation, that's the level or the percentage of oxygen within the blood, between 98 and 100%. In addition to vital signs, as we've just discussed, there are a range of other assessments that are completed. Usually these assessments are completed by the nursing staff to determine the health status of our clients. The first one we're going to look at now is a pain assessment. Pain assessments are completed on a client to determine if they have any acute or chronic pain. These assessments can be done either verbally by asking the client where their pain is, how bad the pain is, and to describe the sensation of pain, or non-verbally for a person that is unable to verbalise their pain. A common non-verbal pain assessment is the Abbey Pain Scale. As you can see on this slide, this is a diagram of the Abbey Pain Scale, which shows that a client's pain is assessed using this scale by using their facial expressions. Another common assessment completed by nursing and care staff is checking a client's blood glucose levels, also known as BGLs. Blood glucose levels is a measurement of the amount of glucose that's present in a person's blood. The normal BGL for a healthy adult is approximately 5.5 millimoles per litre. However, this fluctuates naturally throughout the day, given how much exercise the person's done and when they just recently ate. People that have a diagnosis of diabetes will have their blood glucose levels checked regularly to make sure that they are in a healthy range. Another assessment that's regularly completed is a neurological assessment. This assessment is completed often on a client after they've had a fall to check the function of their central nervous system, including the brain. A common type of neurological assessment that's completed is known as the Glasgow Coma Scale, a GCS. This checks the eye-opening response, the pupil response, vital signs and motor function of our clients. The GCS is a numerical scale where a score is given to the client out of a total of 15. Based on the score of the GCS, the nurse will then determine what needs to be done for that client, whether it be they just need to be further monitored or if they need to be admitted to hospital. Next, we're going to talk about physical assessments. There are a great number of physical assessments that will be undertaken by a nurse to assess the physical health status of a client. Some common physical assessments that you may hear of are a cardiovascular assessment to check the function of the heart and the blood flow, a respiratory assessment to check the air entering and exiting the lungs, a gastrointestinal assessment to check the function of the stomach and the intestines, and a musculoskeletal assessment to check the strength and the balance of a client. The final form of assessment we're going to talk about now is a urinalysis. A urinalysis is a test taken on a sample of urine. A urinalysis is used to detect and manage a wide range of different disorders, such as urinary tract infections, kidney disease, and also diabetes. The most common reason a urinalysis is conducted in an aged care context is to check if a resident has a urinary tract infection, also known as a UTI. We are now going to look at the importance of clarifying any implications or abnormalities in a client's health status with your supervisor. It's essential that you always work within your scope of practice. Have you heard of this term before, scope of practice? Well, scope of practice describes the procedures, actions and processes that healthcare staff are able to undertake whilst keeping in terms with their training and level of competence. So, for example, if you're trained as a lifestyle and leisure worker, you would not go and administer insulin to a resident because this would be outside of your scope of practice because you haven't had the training and you don't meet the level of competence to do so. Therefore, you are not to complete tasks that are outside of your scope of practice. Remembering it's always important to follow your organisation's policies and procedures, and you should always report any variances in a client's health status straight to your supervisor. Throughout the life cycle, there are variations to a person's health status that may occur. Sometimes these variations are seen as normal, as a normal part of the stage the person's in within their life, or they may be an indicator of a potential or actual health issue. So for example, it may be seen as normal, a normal part of ageing for an 85-year-old lady to take her time to stand up from a chair and walk down the hallway to the dining room. Whereas for a 21-year-old lady, it would not be seen as normal if she took a prolonged period of time to get out of her chair and walk down the hallway. If this was the case for a 21-year-old lady, this would require further investigation to see what was causing the delay in her standing up from the chair and walking down the hallway. Let's now talk about the importance of identifying potentially serious health issues within a client. A potentially serious health issue could pose a risk to the well-being of the client, either immediately or in the direct future. Or it may create complications when a particular procedure or treatment is given to that client. Whenever you recognise a potentially serious variation from a person's normal functioning, it's essential that you respond appropriately and report this to your supervisor as soon as possible. Your supervisor may then go on and refer the client to the appropriate allied health professional, such as a GP, a dentist or a dental technician, a physiotherapist, a dietitian, or a speech pathologist, just to name a few. It's also very important that you document in the progress notes of this resident the variation that you observed of their health. Now I'm going to look at the human life processes. There are 7 human life processes that keep us alive and well. The first is movement, allowing a person to move from one area to another or move their arm, leg or head, etc. The second is respiration. This includes getting energy from the food that we eat. The third is sensitivity. This includes detecting changes within our surroundings and then our body acting accordingly. The fourth is growth. This includes growth and development. The fifth is reproduction. This includes reproducing and the replacements of cells. The sixth is excretion. This includes getting rid of waste from the body in the form of urine and feces. And the seventh is taking in and using the food that we eat in a good manner. Our final topic in this webinar is homeostasis. Homeostasis is a complex process. It is a self-regulating process by which our body systems maintain stability while adjusting conditions that are optimal to our survival. The aim of homeostasis is to maintain equilibrium within the body. With homeostasis, different body systems work together so that our body can function the most effectively. A common example of homeostasis is the control of our body temperature. Normal body temperature is around 36.7 degrees, but various factors can affect our body temperature, including exposure to a hot or cold environment, hormones, our metabolic rate, and disease. The body temperature is controlled through the hypothalamus, which is located in our brain. Information about an individual's body temperature is sent to the brain, and this results in an adjustment to breathing, the level of blood sugar within our systems, and our metabolic rate. So, for an individual that's too hot, the message will be sent from the brain to perspire or sweat, and large volumes of blood will begin to circulate close to the surface of the skin to aid in the loss of heat. Whereas, for an individual that's too cold, there'll be decreased blood volumes and less blood circulating close to the surface of the skin. The person may also begin to shiver. These are just a couple of things that may occur to try and regulate a person's body temperature and body heat. Thank you for your participation in this webinar. Continue now by watching the following video that explains homeostasis further, and then continue on by doing your quiz and your assessment. I'd like to thank you all for your time.